let me give you your code. I'm going to say it out loud, and I'm also going to write it in the chat box. Now, when you are done, I do not need to see your screen. I can tell if it's uploaded. One of the things I want to let you know, if you can't upload it right away, which happens sometimes, your exam doesn't disappear. It doesn't go away. Don't get nervous. I can get it a week later. So don't have a moment, because I've had students get really stressed. It's still there. Don't worry. I can tell you if you did okay, you did good, or if you need to come see me, and review your exam. That's all I can tell you. We will be doing a review tomorrow, Professor Brunel and I, about 2 o'clock. So you'll be getting your grades posted right after that. I am always here to go over an exam with you. So if you see, even if you get a 90, you want to know what you got wrong, make an appointment with me. I will meet and we'll go over those things so that you know what was wrong, okay? Any questions? All right, you good? You ready to do this? All right, I know you can. You guys have worked hard and I see that. So let me just. I will repeat the code twice. I'll put it in the chat box. Once I do that, I turn my screen off so it doesn't look like I'm staring down your throats. And I turn me off of volume so you don't hear me. If you need a resume code, a universal code, give me the number the computer shows you. I will get back with you shortly. Remember, there's more than one student here. Okay, so give me a moment. I will give you what you need. Whatever happens, put it in the chat box. Be respectful of your other fellow classmates. Okay, so here we go. Let's give you your code. Remember, come back at 4:20 Eastern time. All right, here we go. This is your code for this exam. Number 9, capital H, capital G, number 4, little d, little v as in victory. Again, number 9, capital H, capital G, number 4, little d as in dog, little v as in victory. And good luck, everybody. Remember, chat box from now on.
Hi, Professor.
Chat box from now on.
Good afternoon.
Okay, we've got all the students done. Thank you for your patience. I know it's hard, but I'll always let you know what's going on with a message in the chat box. So thank you for paying attention to that. I know sometimes we have outbursts and say crazy things. It's okay. We learn our lessons if we've heard it once. And it's just respect again for the other students in the class. So today we're going to go over chapter 21. Now, I have a PowerPoint and I have a Kahoot. Now, I've got two PN classes, your class, and I have one that follows. Do you want to do a PowerPoint or would you like to do a Kahoot? You have a choice.
I would rather do a Kahoot.
Kahoot.
Okay, we can do that. And then what I'm going to do is I'm going to be sending you the link to the other class so that you have the PowerPoint, because I'm going to do that for them later on, okay? So literally you get both, but you guys get to play the Kahoot. I believe I made like 30 questions in it, so it is pretty comprehensive to the material that we're covering. So it is a good Kahoot. I'm trying to make sure as I teach this PN course, making sure that all the concepts that you're going to see on exams and HESI and NCLEX are covered in both PowerPoints and the Kahoot. So I am redoing PowerPoints, I'm redoing Kahoots. So I'm trying to beef them up for you so you have all that information. Now, I know exam one was a difficult one. I understand that. I am reviewing with the other professor, Professor Brunel, tomorrow at 2 o'clock. We will look at those questions that were troublesome to students, and we're going to see if we throw them out or if we keep them. So a review will be done tomorrow. That's why I don't give you your exact grade today, because it will change in one way or another, okay? And it's for the better. But are you borderline? Did you do good? Or do you need to meet me? Those are the three things that I'll ask. If I ask you to meet me, you have done less than borderline. And I really want to get with you so that you do understand what's going on in this class, okay? I want you to catch you up now because there's 2 more exams and a HESI, and we can get you through this course if we meet and if we talk to each other and that you understand these concepts. It was a rough exam in that regard. So here we go. Remember, anyone who wants to do a review on that exam, let me know. I won't take up 3 hours of your time. I don't do that. I'll just give you those concepts that you really need to understand. And then you can apply them more as we go further on in this class. Because all these growth development things that you've been learning will be now looking at diagnoses and how do you work with these children with these diagnoses. So here we go. Week 4, chapter 21.
Professor, sorry, when will we know if we need to meet with you?
Tomorrow. Which child would have the most difficulty in coping with separation from parents in a hospital? If you send me a message and I say to meet with me, it means that your score isn't where it should be. The final results are out tomorrow afternoon about 3. So most trouble, difficulty with separation from parents are that toddlers. Remember, toddlers like routine, they like security, they like mom. A 3-month-old doesn't really understand that yet. A preschooler can put up with that change and that separation. So it's not that. And then of course, a school-age child can also be told what's going on and they can be all right. It's that 16-month-old that has issues.
Can you give me the pen?
Sure, I can. It is 380601. 380601. A 2-year-old child's been crying constantly for his mother since he was hospitalized 3 years ago. Now, we know that there are feelings of separation, anxiety that goes on with children. And it starts out, and there's 3 levels. They go crazy, they're crying, then they sort of get into it like and get distant, and then they go into despair, which is now they're depressed and they don't even care if mom comes. Now, why is a kid crying? The mom isn't there. They're crying. This is the first stage of separation anxiety. And these toddlers feel like, Mom, where is she? She left me here. They don't understand. A preschooler might, the school age definitely will, but not a toddler. I think it's the hardest age of that understanding for, those changes in environments. Which statement best corresponds to a preschooler's understanding of hospitalization? Now, your preschooler is ages 3 to 5. Now, remember, these kids feel that if they've done something wrong, that God is punishing them. Okay? So whenever they get sick, it's because they didn't listen, they hit their brother, mad at their brother. That's why I got sick, and that's why I had to go to the hospital. It's because God, of whatever your name of God is punishing me. And that is what they believe in. The toddler seems more interested in her toys than the parents. Which stage of separation anxiety is this? Remember, there's 3 stages of it. This is something, go back to your book, look at this. This is something you'll see again and again and again. So we go through first that protest, cry, 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 cry. Then it's denial. It's like, I don't even care if you're here, Mom. And then it goes to despair, where they're depressed, they regress, they suck their thumb, they start, being incontinent when they're potty trained. So there's 3 specific distinct stages that a child will go through. And remember, toddlers are more pronounced in that, separation anxiety. Older children tend to understand it. Mommy has to go to work, or mommy has to go to such and such's ball game. Your brother wants me there, but I'll come back, I'll bring you pictures. They understand that. Toddlers don't. Remember, me, mine, mine, mine. That's a toddler. Which roommate would be most appropriate for a 16-year-old adolescent with cystic fibrosis? Well, we sort of have to understand cystic fibrosis. Now, cystic fibrosis is extra mucus, which clogs the lungs. It also clogs the GI tract. So it's nutrition and it's also lung issues. Now, it's not an infection. And they're very prone to getting infections. So you don't want to put a baby or a screaming kid in that room or an infected kid in that room, okay? So you want to put a kid about the same, 15 years old. They have diabetes. They have a condition which needs treated, but they're not infectious. Each one is not going to harm each other with an infection or be an annoyance to them. That 10-year-old with sickle cell is going to be crying in pain, okay? A private room? No, you don't want a kid alone. An adolescent? No. Remember, they like to be around their peers. It's all about their buddies and them. It's not really about mommy or daddy. I mean, they do regress sometimes and want them there, but mostly give them a kid of their own age. So that diabetes child at 15, perfect choice for a roommate for that child. Parents of a hospitalized 9-month-old infant ask if their preschool child may see their younger sibling. This is a big deal. You have a kid's in the hospital, and you know that children at home are worried about the child in the hospital, and the kid in the hospital, depending on the age, are worried about the kids at home. Both ways, they're worried. Now, it's a 9-month-old infant, and why do you want to bring that preschool kid in? Well, they're worried about him. They want to see he's okay. They want to touch and feel him. Again, prepare the child on their developmental level of things they might see. They might have tubes and things in their nose and IVs taped on or something, or alarms, monitors. Prepare the preschooler child what they will see, okay? Some of them are intubated, right? They can't talk. So getting them prepared, again, on their developmental level, it is great for that child who is left at home and is really, really worried. Because the last time they knew, the ambulance came and took my baby brother away, right? A hospitalized toddler was drinking from a cup at home, but now refuses to drink from anything but his favorite bottle. Why is he doing that? Toddlers. He's in the hospital. He just wants a bottle now. Or maybe he goes back to sucking his thumb again, right? This is the way children tolerate being in situations that are different and scary. They're stressed, but they don't know how to express stress. So they show you. It could be, again, being incontinent when they're potty trained. It could be sucking their thumb that they haven't done. Or maybe they don't want their sippy cup, they want a bottle. Or they need the diapers again, or their favorite blankie, whatever it is. You're going to see them regress to an earlier stage, which gives them comfort. And remember, oral is always that thing that they get stress relief from. Infants and their pacifiers, that's their stress reliever. Could be their thumb. So when you're seeing something that's putting them back in their level of development, think about stress. And then we can find out why. We can reenact that through a dramatic play therapy and find out why. And we can eliminate that stress, or a lot of it. A multi-select. A nurse encourages a school-age child to draw a picture after a painful procedure. Why are we having them draw pictures? They just had a painful procedure. Let's say they just had a spinal tap, or maybe a bone marrow aspiration, or they just had a chest tube removed. They hurt. Why am I taking a picture? Well, this is a way a kid who maybe can't verbalize the way they feel can put it in a picture. They're expressing their feelings. Also, when they're doing this, are they thinking about the pain? They're thinking about the picture and the colors of the crayons they're going to use and what type of, figures are they going to draw. Distraction works incredibly about pain. Also, the picture might show that it wasn't the procedure they were worried about. Maybe it's because nobody held his hand. It could be as simple as that. And nurses do hold hands all the time. When is the best time to begin to prepare a 5-year-old for surgery and hospitalization? So they're going to go in and get their, adenoids, tonsils, and tubes put in their ear. We know it. Usually know at least, a couple weeks in advance. When should we start telling this 5-year-old? We don't want to start too early, because now they're going to be stressed for 2 weeks. But it's about 4 days before. So they have times to ask questions, that they have times to think about what's going on, and, wrap their mind around what's going to happen, okay? You don't do it, when you first know. The night before, no. It's like all of a sudden you're attacking them with a hospitalization. And as I said, 2 weeks is way too long. Just enough time for them to be able to ask questions to understand. A 13-year-old girl has been hospitalized for the past week. What is the girl's biggest concern? So she's been in a hospital. What is she worried about the most? Remember, 13 is an adolescent, right? And it's actually her appearance. Remember, it's identity. Erickson talks about identity and the adolescents, and they're worried about body image. It might mean she hasn't been able to wash her hair and it's greasy. And you know, girls like their hair washed and clean and feeling soft. And if it's not, they're going to be worried about it. You know, 13-year-old is the boyfriend, who knows if she has one, but the appearance is the big, big thing. Good job, guys. Most of you did it. The nurse notices the mother of a child with cerebral palsy redoes many of the things that the nurses does. What's the nurse going to ask this mother? Like, I just did that dressing. Why are you redoing it? I just turned the child over on their side and you're fixing it, doing it your way. Like, am I not good enough for you? I mean, it could be perceived like that, right? Do we need to talk to the mother like that? No. What you need to do is say, Mom, could you tell me the way you do things so that I can do them the way your child's used to it? And then as you're doing it, you'll say, so why do you put that there like this? Because I want to, you know, your kid and you work with, you know, him for so long. I want to learn from you. Can you teach me? And you know, that mother will be very pleased to teach you everything. And she's probably going to do it even better than she did it before. So, you know, telling them you're going to be doing the best or sending them out to redo it. No, you know, this mother has taken care of this kid. Sometimes the kids are 18 years old for their whole life. You're not going to redo what the mother does unless it's something she's doing really wrong. And then very nicely you say, well, if you do it like this, this can happen. So could you try to do it this way? Because when you do it this way, la, 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 la. And I'm telling you, the mother will listen. It's how you approach it. Because we're not almightier than that. I mean, parents have taught me so much, and I listen. He, the toddler, cries when I visit. Maybe I should just stay away, says the mom. What is the nurse's best response about this? Again, this is all about separation anxiety. All those 3 levels, acts in a different way. So I'm saying, go to your book and read about this. Very important concept to understand. Again, extremely common. They cry and go bonkers initially. And then all of a sudden they're like, all right, whatever. I don't even care if you're here, Mom. And again, don't even, when they call their name, don't go to them. Or, you know, he cries because he knows you're leaving. I mean, these things are part of separation anxiety, those different 3 stages of it. So we can tell Mom that it is common, you know, and it's just because you have to go home and it's okay. This is how your child tells us he's stressed. So just sit there and just love your baby and it's going to be okay. You know, he needs you, but he doesn't know how to say it because he's angry also. But, you know, you got to do what you have to do because life goes on. Prepared to collect an admission history from parents who have recently immigrated from Russia. What are you going to keep in mind? So again, this is a cultural thing. Remember, there are so many cultures. They all have their different idiosyncrasies about what is right, what is wrong, how to do things. And we don't understand them all. We will never understand it all. Now, smiling is inappropriate for a Russian culture. There are some cultures you can't look at them in the eye. There's some cultures that there is a special box around them and you don't enter that. It's their personal space and they don't like it. Or they want you not talking to the mother, they want you talking to the father. There's all different things. And do you know what I would do from a culture I don't know? I would ask, tell me how you want me to approach you. Tell me what's appropriate for you. I don't want to offend you in any way. Because even if you do, you've already said you didn't want to. So it's a mistake. I don't understand your culture completely. I want you to teach me. I'm excited to learn, right? That's the better way to approach it. Which nursing action would facilitate rapport with the child and the child's parents during the admission process? So you get a kid, doesn't matter what age, right? You need to do an assessment. You need to build a rapport because you're going to be working with not only the child, but the family or who's ever there at the bedside all the time. So how do you support it? Well, if they're there and they're asking you questions, you're like answering the questions, you're calm, you're not annoyed, it's not bothering you that they're asking questions. It makes them feel comfortable that you're there to help them, not just to be the nurse who knows everything and condescending. That's not going to help you. And actually, that's what shows the concern when you're in that calm, answering questions mode. It does. A 4-year-old child begins to cry when his mother tells him it's time for his operation. Which particular fear is this? So a 4-year-old is a preschooler. He needs to go in for his surgery. And now the kid's there, he's just crying. What's he telling you? What is this fear? And what it is, it's an invasive procedure. Remember, these children think when you cut them open, their insides are going to fall out. You need a Band-Aid. Remember, this is the age of Band-Aids. They think they're going to bleed, and they're going to die. Okay. Again, also, these children feel they've done something wrong. That's why they're doing this. Something in their body is not working right because I did something wrong. I'm being punished. So these things are something to remember when you hear these different ages of children crying, because this is where their minds are. They don't know how to express it again, though. They don't understand that. How do you know the parent understands a hospitalized toddler's need for transitional objects? What is a transitional object? Isn't that like the blanket they need to have to go to sleep or their special sippy cup? So which one of these says, Mommy understands? So my grandson loved to have, and it was a stuffed giraffe, this little, one of those little stuffed animals. He called it Mr. Puppy. Why he called it Mr. Puppy, I don't know. But that thing, if he had it to go to bed, everything was good. So if I had that child in the hospital and he didn't have Mr. Puppy, he wouldn't feel secure. He needs that something, that's that stress reliever, gets them calm. It's like that infant with a special pacifier, the one that you lost and you can't find a replacement, and the kid's going crazy, he wants that one back, right? It's the same thing. It's the parent knows that that's what makes it feel better. It's not getting a toy, any toy. It's not, that he wants to bring this dirty blanket. Well, maybe that blankie is like that stuffed toy, and a new anything isn't going to work. It's that Mr. Puppy you left home. That's what he wants. What advantage of fentanyl for an upcoming procedure will the nurse explain? What is fentanyl? This is a very common narcotic used, and it's used with newborn babies. And what it is extremely powerful, okay? But we give 1 mic per kilo per dose. Very simple, up to 5 mics per kilo per dose. So we know how much to give, just like a morphine, but it works quickly. And the other thing is only lasts for 1 to 2 hours. So the onset is quick, and then it's not like lasting for 6 or 8 hours, like maybe a pill of Percocet would last longer, right? That's why we try to get you on the pills so that they last longer. Fentanyl is great, works quick, lasts, strong medicine, but then it's gone pretty quick in it, okay? And it's designed for all age people, and it's extremely addictive. It's just like morphine. Actually, it's stronger than morphine, stronger than Dilaudid. The nurse shares the information and timelines recorded on the interdisciplinary outline of care. What is this document? Interdisciplinary outline of care. What does that mean? And it's basically called a clinical pathway. Now, let me try to describe it. You have a child come in. Let's say this child comes in with a sickle cell crisis. There are certain things that are going to happen. You're going to draw this lab, you're going to give this antibiotic, this for pain, and this is what we're going to do on a daily basis until they go home. This x-ray will be done, this ultrasound will be done. It tells you what you, it's like the doctor signs this outline, and we're going to follow it because this is what every child with this is going to get. And then, of course, the doctor can cross out or add things as they want, but it's that outline of this is what's going to go on. And nurses know, all right, I've been working on the sickle cell floor forever, the hematology floor, and I know what's coming next because it's on that clinical pathway. They've been doing these for years and they work really well. And it actually, they found these clinical pathways are the best care we can give. It's been researched, it's been proven that following this pathway has the best outcomes for your patient, client, whether child, whether adult. They started using those for like adults with myocardial infarctions. That's where it started, believe it or not. And then they went to all ages, all diagnoses. The nurse is preparing to start an IV on an infant admitted to the pediatric unit. What intervention is appropriate? I think one of the things with parents is you have to stick a needle wherever to get an IV in, and they just don't want their little babies hurt. Especially those newborn babies. You're like, oh, they're going to get this big needle in their arm. And, it is very frustrating for parents, but you need to involve them. Now, what would I do? Let's say I'm going to start that IV in that hand. Remember, I'm going to choose the hand that they don't suck the thumb on, right? They suck the thumb on the right hand. I'm not going to use it. I'm going to use the other hand, or I'm going to use the foot. I'm going to use something else if at all possible. I'm going to have the parents holding, let's say I choose the right hand. I'm going to have them hold the left hand. I'm going to give that infant a pacifier. Remember, self-soothing. They're going to be sucking that non-nutritive device, right? And that parent, I'm going to tell them slowly, just talk quietly to your baby. And that now is distracting that infant. And we're holding the hand down, right? We're not, if it's an infant, let them examine the equipment. They don't know what you're doing. An explanation, infants don't understand. It's that soft, quiet voice of the mother, which gets them calm, right? And sometimes, depending, of the age, maybe it's an 8-month-old who's a very nervous kid. I'll have the parents hold the child, and I'll have another nurse hold the arm, and they'll be sitting holding, and that can also help, depending. So depending on your infant, depending on your parents, doing some things involving the parents is better for the child and better for the parent. A multi-select. What will the nurse include when documenting the discharge of a pediatric patient? Select all that apply. So kid's finally ready to go home. It's been a long visit. And now the nurse needs to document. So what do I need to know? Well, I want to know who was there, that you did discharge them to a mother or father, that it wasn't somebody else. So legally, you gave the child to the correct person. Did they go home by car? Did they go home by ambulance? Did they take a taxi? Sometimes that is it. Condition, what does the child look like? Kid is well, breathing easy. If they came in with, let's say, that sickle cell attack, no pain, pain level 0, right? What time? What time of the day? So something happens to that child later on, you've documented, no, the kid was out of my care. That was somewhere else. You're not responsible. Also, written discharge instructions were given to that parent. But beyond that, how about parent understood discharge instructions, right? So now that you gave the instructions, they also understood it. And you don't need instructions that were given to the physician, maybe by the physician, but not to the physician. Okay, so that was just reading that question and those words in there. And let's do one more, a multi-select. What are the basic fears of a young child being hospitalized? Select all that apply. Basic fears of a young child. I mean, how young is this child makes a difference too. Because cost could be a concern if the kid was older and new parents were struggling with money. Okay, so that's one of that, really how old. But remember, body intrusion. Did we open me up? Are my insides falling out? Am I gonna bleed? And I'm going to bleed to death. That is a huge fear of children. Again, separation anxiety, all ages. And I mean, you see it mostly, as I said, those toddlers are the big ones with separation anxiety. But preschoolers, school age, and even adolescents do have some separation anxiety. And you're going to the hospital. When you think of a hospital, you always think of needles. You know, whether it's getting injections, IVs, you always think something's going to happen that's going to hurt. So it's always pain, okay? All right, let's see how we did here, guys. Well, we got a duck. Cute, Alex. Charday, good job. And Christina. Our runners up. Tamika and Tim, good job, guys. All right, let me get out of here. Let's go over and see what we have to do for this week. Make sure you know all your assignments. Remember, I have gone through and I have looked at NCLEX questions. If you see a 0, remember maybe the wrong type of questions were sent to me. And I'm not going to take off points for that. Just please resubmit them if you see that there, and just let me know about it. You do have a discussion question due this week. Now, when you do discussion questions, and I've seen this across the board, you need to do a citation in the middle of a paragraph, which means you have references, which are great. But in the paragraph, you need to do a parentheses, the name of the book, comma, and the date of the book. So let me just quick show you what that would look like. Hold on. So let's say the name of the book was Smith. So you have all of your paragraph going, and then right before the end of the paragraph, you put a parentheses, you put Smith, comma, and the book was in 2020, and a comma, and your periods on the end. Do one of those within the body of the paragraph, and then I can give you those extra 2 points, because then you're getting 18s. You're getting 18, 18, 18, okay? So if you want to get that perfect 20 on those discussion questions, just do that, and I will, get your grades better. If anybody needs help with that, let me know. But, pretty well, all in all, your discussion questions have been done quite well. So I do appreciate that. Anybody, again, who needs to do any dosage calculation, I can help you with. So just let me know. I have a very easy review that I've sent to you, and I've sent you the worksheets already. I can go over it with you in 10 minutes and get you right back online to help you with it. I would hate anybody to be getting -2 points on a question, because these math questions are not horrible. They're very simple. And if you're not understanding them, I can make them simple for you. Does anybody have any questions or concerns? No? You guys are all tired? Your minds are all gone from the day?
Yeah.
Okay, I understand that. So again, if you want to know what your exam was, sort of, I can tell you if it was good, if you're borderline, or if you need to come see me. And please don't take it as pow pow, you're a bad girl. No, I take it as an opportunity for learning. And I want to know who you are, and I want to know how I can help you. Okay? I was not a good student when I went to nursing school, believe it or not. I didn't like exams, but I am a good nurse because I did ask questions, and of course, my higher level degrees are all excellent scores, but nursing school, I just got by. But I asked questions when I needed help. So again, anything you need, ask questions. I'll work around your schedule. The only time I can't see you is when I'm teaching another class, okay? I am open Tuesdays and Thursdays most of the days, okay? Thank you guys for a great class. I will see you next week, unless I'm seeing you before that to review your exam. And trust me, I'm not going to take an hour on a review. I can do it in 10, 15 minutes. I know your time is very, very limited. So I'm not going to hold you up, but I will give you whatever time you do need to help you.
The next study guide for the next exam.
You'll be getting the study guide for the next exam by next Friday.
Okay.
I always try to get it out a week early. I was a little delayed with this one only because I wanted to make sure you had all of the information you needed, but I am already working on that study guide right now, okay? Okay, good, good. All right, guys, you guys have a great afternoon. Thank you. Have a nice weekend. Thank you.
Did you want us to say we wanted to